Okay, so one of the reasons why you might have symptoms in your legs is because you could have an undiagnosed spine issue. I think a lot of people don't realize that their muscles and joints in the lower body are all given life and activation because of their brain and spinal cord. So the legs are all innervated or given life by the L1 through S1 and below nerves. In the spinal cord, these nerves come off, okay? In the brain, obviously, you have a control center there so that your legs can move, your arms can move. But in the case of spine disorders, if you're having chronic pain or irritation in your outer glute, the inner thigh, the front thigh, the knee joint, maybe it's in the back of your knee, then it could be because you have an undiagnosed spine disorder. Many adults suffer from degenerative disc disease. They may be asymptomatic, where they really don't feel any symptoms in their back or their legs, but they might experience a flare-up every now and again. So if they haven't had an MRI and they haven't had to go to physical therapy or to the orthopedic doctor, then they may not realize that they have what's called degenerative disc disease. So level 1, degenerative disc disease is where these discs start to compress over time. Then it can start to turn into a bulge and then a herniation. And once it's herniated, the disc gets thin. It's called a thinning disc. The problem is the disc holds space in between the two bones. In between the two bones are the nerve roots coming out of the holes from the spinal cord. So in this case, this spine model has an L4, L5 disc bulge on the right side. So now this right L4, L5 nerve is getting pinched, compressed, squeezed. That L4, L5 nerve is not a stub. It actually starts in the back, but then it wraps around from your back to the outer hip, the inner knee, all the way down through the inner shin and lands in the bottom of your foot. So the L4, L5 nerve distribution starts at the back and ends in the foot in that pattern. If you look up dermatome man or dermatome, D-E-R-M-A-T-O-M-E, you'll see a sketch of a man with all these different colors cut out that correlate L4, L5, L5S1, L1, L2. So the L5S1 starts in the lower back and then it turns into the sciatic nerve as it goes through the sciatic notch. It goes down the hamstring and then to the back of the knee, the back of the calf, and then it splits off into two nerves called there's a tibial nerve, there's a peroneal nerve, and they just branch off. So then for an L5S1 disc bulge with nerve root compression, the pattern of pain that you would feel could be anywhere along that path. You might just feel it in the pinky toe or the heel. So as you go up, L1, L2 is in the groin, L2, 3, 3, 4 is in the quad, L4 is usually the inner shin, L5 is the outer shin, S1 is always the back of the calf and the heel. If you do have lumbar degenerative disc disease or something worse and you're getting symptoms into your legs, the way that you take care of that is, yes, you can strengthen your legs, you can massage your legs and do all the foam rolling, but until you get to strengthening your back, your symptoms will continue to persist, possibly. So in order to deal with that, we want to create strength in the abdominals, the lower back, the pelvic floor, and the respiratory diaphragm. In order to take pressure off of this disc bulge and the nerve root compression, we just have to strengthen the core, the spine, the deepest core muscles of the spine. So we would target here the transverse abdominis right across the lower belly, the multifidus in the lower back and middle back and all the way up. Those are very deep muscles that are segmental or short muscles. They go from like S1 to L5, L5 to L4. They're very short and they connect each and every vertebra. They create stability as opposed to the long muscles called the erector spinae group. You also want to strengthen the pelvic floor, the Kegel muscles, drawing the muscles in and up, feeling strength at the base. And then you also want to strengthen and optimize your diaphragm. The diaphragm muscle is your primary breathing muscle. It acts like a parachute where when you inhale, your belly should rise and the diaphragm will descend. As you exhale, the belly should flatten and the diaphragm should rise up into the rib cage area. So if you think about it, the abdominals, the lower back, the pelvic floor, and the diaphragm are all shaped in a cylinder. And we call this the trunk cylinder concept. There was a research study done back in the 90s by Hodges and Richardson that showed if you strengthen the trunk cylinder, you would reduce compression in your lumbar discs by as much as 40%. And that's huge. The stronger your core is, the less compression your discs are going to get. So in order to help strengthen the back, reduce symptoms in the glutes, hamstrings, the front thigh, and try to preserve the nerve function and the disc and bone function, then you want to strengthen your deepest core muscles by doing therapeutic Pilates, therapeutic yoga, and spine stabilization. I've been using this lumbar cuff for many years to help patients figure out how to strengthen their abdominals, very specifically with visual feedback. It looks a lot like a blood pressure cuff, but this thing is going to go under your back and you're going to read this little meter to follow the numbers. So if you look here, it starts at 0, but then as I compress, the needle will go all the way up, and then as I release, it should drop again, okay? So anytime I'm squeezing the cuff, the needle will go up, and as I take pressure off the cuff, the needle will go down. So in this case, you would place this stabilizer cuff underneath of your lower back, right in the area where there's an arch. So like that natural arched lumbar lordotic curve. And then you would lie on your back with a pillow. If your head is flat, you may not get as much activation of your abdominals. And so now once I'm lying on this, just in a relaxed position, I want this number to read at 40. So there's a little orange line, and this particular product comes with a manual and it will show it to you, but just taking you through the video might help you learn this faster. So first, my knees are bent, my feet are flat, I don't want my legs straight right now. I'm gonna look at this stabilizer pressure biofeedback meter, and I'm gonna tuck my tailbone under, imprinting it down so I'm squishing this little cuff under my back. And so when I do this, the needle rises all the way up to 100, 110. And then I want to arch my back, rocking the pelvis forward into anterior pelvic tilt. So the needle now dropped down to 20. Remember my resting position was 40. So as I tuck imprint, it goes to 120. As I arch and create space, it drops to 20 or 18. Tuck imprint, arch, create space, tuck, imprint, arch, create space. I want to do that several times so I get a general idea of what my baseline is. As I did that repeatedly, I hit 20 and 120, 20 and 120 regularly. So now I want to take those two numbers, add them, so it's 140, and then split it in half. So I want to find the mean, and that gives me 70. 140 divided by 2 is 70. So that's my neutral spine. I want to try to get the needle to 70 on this meter in order for me to find my neutral spine. Without looking at this, this is what I'm going to do. Tuck imprint all the way to 120 and then release about 5 to 10%. And that should get me at neutral. And I'm at 80. So I was pretty close. I'm going to back off a little bit. And now I'm at 70. And there's actually a little red line at 70. So my neutral spine is the exact middle point between the two extremes of posterior pelvic tilt and anterior pelvic tilt. It's right in the middle, but that means that my abs have to be active. I'm really working hard to keep my transversus abdominis, pelvic floor, and diaphragm, because I'm breathing and talking, and my lower back muscles on. From here, I watch the meter, and then I'm going to march in place, lifting one knee up at a time, trying to keep the needle in the red or at 70 the whole time. If the needle starts to pop up to 75 or 80, that's okay, although I really want to try to keep it still. If the needle drops below 70, my abs have shut off. So now I'm at 60. I got to go back to tucking and bracing and then marching in place. I did forget to mention that when I found neutral spine, once I was in that neutral position, some people can find it, but their abs don't really engage. You actually want to isometrically contract your abdominals as firmly as you can. I use kind of an extreme cue when I'm teaching Pilates. I say, pretend a bag of bricks is going to fall onto your stomach. Or I'll say, pretend someone's going to punch you in the stomach. How are you going to protect your organs and get your abdominals to be rock hard? So as you're hardening your abdominals, you're also contracting the pelvic floor Kegels and you're breathing. So here I am still at 70. So I want to do marching 10 times, watching this needle. I want to do hip rotation out and in, switch, out and in, switch, and my needle's already dropped. So let me concentrate and look at this and try to keep my neutral spine as I'm bracing firmly. I feel like it's harder to keep it neutral when I go out and in because my opposite pelvis kind of wants to wobble and lift. So there's a great deal of mind-body concentration happening here. And then I'm going to relax, release for a moment, just let my muscles breathe. Now, for straight leg raises, as soon as I straighten one leg out, the needle is going to drop because when my hip is straight instead of bent, it's going to cause extension in my lumbar spine. My baseline is now changing. So as I'm laying here, when I do a full posterior pelvic tilt, I can't go to 120 anymore. I'm hitting like 80. And then I arch and I'm at 20. Tuck, 90, arch, 20. Tuck, 90. Okay, so 90 plus 20 is 110 divided by 2 is 55. Right there is 55. Flex foot, brace core, lift left leg up to the height of your opposite knee and keep it at 55 in my case. So I'm watching this. As the needle drops, I'm bracing harder. Really concentrating on getting transverse abdominis, multifidus, pelvic floor, and respiratory diaphragm. Okay, so 10 repetitions on the left leg, 10 repetitions on the right leg. This is strengthening my core spine muscles to actively decompress my discs, nerves, and muscles. So I don't get symptoms from my lower back into my glutes, into my hips, hamstrings, legs, knees, toes. Okay, level 1 spine stabilization series is pelvic tilt, neutral spine, isometric abdominal contraction, core contraction with marching, core contraction with hip release, core contraction with straight leg raise, and then you can progress to level 2. Level 2 is as soon as your knees are lifted in the air. So right now I've had one foot on the mat at all times. As soon as I lift my knees into the air, I've got to use my abs more automatically. So now, as I'm here in tabletop position, I'm imprinting my lower back, it goes to 100. I arch and it goes to 40. So 140 divided by 2 is 70. My neutral spine is 70. I'm going to tap, lift, and switch. Tap, lift, and switch. Trying to stay at 70. If the needle drops down, it means my back is arching and my abs shut off and my back shuts off. Okay, so I'm just mastering this. Tabletop position, toe or heel taps. Doesn't matter, either one. And then the challenge from heel taps, because this is a short lever, is to straighten one leg long and bring it in. Other leg is long and bring it in. And I'm really working hard to keep this needle at 70. It's wobbling a little bit above it and a little bit below it. Okay? This is a Chattanooga stabilizer biofeedback cuff. I used to buy it directly from Chattanooga about 20 years ago, but they have been selling them on Amazon. So I think I've had 2 that have broken already. So this is like my 3rd one. And it's this gauge that kind of gets wonky. It used to be like $160 to $180. I last bought it on Amazon for about 60 bucks. When I just recently checked, they were out of stock or it was unavailable. So I did find an alternative. It's called the Core Coach, which this is $60 as well. This is also sold on Amazon. And it has the same exact concept where you have this little gauge and you can pump it up. And now here it has like these little targets, and they have a manual as well. So you might want to just see what you can get your hands on, and then this will help you to train. So with that, you're strengthening your hips, your knees, your core abdominals, your lower back to help get symptoms out of your legs. If you have any questions or comments, please reach out to me.